Hello, I'm John Grom, and welcome to our 165th Right and Left Discussion Forum. We hold our televised discussions twice monthly to demonstrate the value of civil, productive, open-minded political dialogue. Today, our panel will discuss the COVID-19 pandemic and how it has been managed by federal, state, and local authorities. On our panel today is Patty Haskins, member of Wadsworth City Council, Joe Gaines, member of the faculty of the University of Akron, and Dr. Ronald Chamberlin, retired senior research chemist. Patty, the United States has not seen the likes of the COVID-19 pandemic since 1918. Given the largely unknown nature of the disease, especially early in the year, and the less than clear-cut lines of authority for dealing with it, how do you think our political leaders have managed it?
I think we need to look at this on different levels. I would say that on our local level, that our local community, and particularly here in Wadsworth, has handled it quite well, as have other local communities, setting up the rules and necessities that would be needed for that particular city. On a state level here in Ohio, I think that Mike DeWine has done an excellent job in handling COVID, particularly when Dr. Amy Acton was working with him. He had a science-based approach to how we would handle the COVID pandemic. I think he listened to the science professionals, to the doctors, and had a good approach, which I think has saved countless lives here in the state of Ohio. Now, on the federal level, I have a little bit of a disagreement. When we look at what happened, going back to the beginning, the first thing that was done to prevent COVID was the China ban. The only problem with the China ban is that over 40,000 people still came into the United States from China. So I'm sure that is one of the ways in which it was transported first into the United States. The same thing happened on the East Coast. Our first big outbreak actually was in New York City. But if you watched when the Europe ban was placed, first of all, when it was placed, England was not included in that ban. And the United Kingdom has had probably the greatest outbreak of COVID in all of Europe. They were added lately, but then only so many days were given for Americans to come back into the country. And I remember seeing the pictures of thousands of people coming into the country that are crammed together in an airport. They weren't tested for COVID. Only thing that was done is that some had their temperatures taken, and then it started to spread. As we moved along, one of the things that biggest problems for me was that it was really that we had to force the government kicking and screaming into the production of PPE and into ventilators. I mean, this was not something that was made available to people from the beginning of the crisis, and it was not taken seriously, as we were constantly told that it was just a few people that had it, that it was going to go away, it would be done by Easter, it was going to be done as soon as the heat came in the summer, and that's not happened. Another big concern was the fact that I saw people that did not even adhere to the smallest of precautions that could be taken. And this started with crowds of people that were protesting the use of masks. I remember watching a protest in the Michigan State House where armed protesters showed up inside protesting the fact that Michigan was setting up bans on certain types of activities and the use of masks. This was a very dangerous situation. This then continued after all of the racial unrest that occurred after the killing of George Floyd. And while I appreciate the concern and the need for peaceful protest and understanding, as I've stated at other times, understanding the frustration that they had, the fact that these people were out in the streets, at least they were outside and many wore masks, but gathering in large groups was, to me, not the smartest thing to do. this has progressed into a president that continues to hold large thousands of people in a rally, some of which have been held indoors, like the Tulsa rally. There was one in, I believe it was Nevada or Arizona, I forget which. I believe it was Nevada, though, was held indoors. And even if outside, where you have thousands of people without masks, without social distancing. This has culminated in the recent Rose Garden gathering, which has produced numerous cases of COVID-19, including our president and first lady. I'm also concerned on the federal level at the lack of interest in science and the refusal to sign it, to abide by it. I've noticed you will not see Dr. Birx and Dr. Fauci talking about COVID now. President Trump has decided that his chief consultant is now a Dr. Atlas, who is not a doctor of public health, nor is he a doctor of epidemiology, but rather is a radiologist. His big thing is herd immunity. And Trump has signed on to this, that this virus isn't that bad. We can get through it. And let's just go for the herd immunity. The problem with that is it is estimated that it would take 70% of the people in this country to obtain coronavirus in order for herd immunity. And that percentage is established by basically bean counters, and it differs for different diseases. For example, for measles, it's like 95%, I think. But for corona, it's been estimated at 70%. Well, if you take 70% of the 328 million people that we have in this country, that is almost 230 million people would have to get coronavirus. The death rate at this particular time is, I think, 2.97. If you take 2.97 of that 230 million, you end up with over 6 million people that would die or would have to die in order for there to be herd immunity. Now, even if we lower the percentages, let's say it's only a 60% that it takes. Well, that would mean that you would need almost 200 million people to obtain it. And then if you lower that death rate down to just 1%, that would still mean that 2 million people would have to die in this country before we achieve immunity from coronavirus. And I am very concerned about that because I think we need to follow doctors that are in this subject, follow their rules. And this country needs to quit scoffing at mask laws and so forth that we have.
Well, thank you very much, Patty.
I love sermon.
Well, you've certainly done your research like you usually do. Ron, what's your thinking?
I was interested in following up a little bit further what Patty did on local levels, and I reached out to people in a number of different states, Pennsylvania, Michigan, Arizona, and California. I didn't hear back from my son in Arizona, but I talked with him earlier. So I asked him about masks, when they were put on, how many people do they perceive as following them, what kind of variations around the state, what do people think about it? I gave you just a couple of details. Pennsylvania, talked to a cousin. She's about my age, has an extended family. When they get together, they social distance. She says, generally, it's fairly strict there. She sees a lot of people wearing masks when she does go out. I've noticed on watching some of that family on Facebook, though, they're not necessarily following that. Same thing with some of my other cousins in Pennsylvania. Some are very strict about it, others are much less so. There's been quite a problem with the shutting down of businesses and businesses failing. As she put it, damned if you do and damned if you don't. shut down, but many are gonna lose their livelihoods on that. It's been a case of that. There's been quite a bit of discussion about that with the governor. Looking at California, mask went in overall in the state June the 18th, a little bit late. Increased shutdowns going on. Schools are pretty much closed there. My family is pretty much staying home, except for going out for essential businesses and things of that sort. My son lives in Los Angeles County. Just to the south in Orange County, he says there's quite a bit less compliance down there. He also notes that that's a strong Republican area. Just keep that in mind for a moment. We went to Michigan. I have a friend there who's very concerned about this. He lives in a suburb of Detroit, fairly affluent, relatively middle-class affluent area. Again, pretty heavily Democratic, he says. There's very good compliance. People, they put things in pretty early. He says they had a problem with masks because trying to get them from the federal government, as you might recall, Jared Kushner, who was put in charge of this, pretty much, as my friend put it, sold it to some of his cronies, who then sold it back to the government. So in Michigan, they put a thing in March. They decided to do it, but they didn't get masks till April. So a little bit of delay there. The Supreme Court in Michigan has just declared unconstitutional a law from about 1945, which allowed the governor to do this. So they said she did not misinterpret the law. She interpreted it as written, but they declared it unconstitutional. I saw a video from her that she said, I still have powers under other acts. I can still put these mandates in. As Patty pointed out, there was an armed protest in the state capitol about that. Again, the Supreme Court in Michigan is strongly conservative Republican. Arizona, my son points out that early on, very, very little compliance with mask wearing, very much problem there. The government kept things open for a long time. Partial shutdowns, rallies are being, there was a rally held there by Trump, and again, that's a Republican governor. So just in this limited sample. Also talked to some friends last night in Ohio. I said, I noticed going out, and my son works in one of the local convenience stores. He says there's pretty good compliance, although lots of people don't cover their nose with their masks, and there are 10-15% or so people who come in who don't wear masks, even though it's required. I was out at the local soft serve ice cream place the other night, and signs all over the place, and 15% of the people didn't have a mask on. So it's still out there. Some friend says it's pretty good in Medina County. Get down to Holmes County, hardly any masks. Again, that's a conservative sort of area. I read recently that the Amish population in general is coming out strongly for Trump, which surprises me a little bit, but maybe not. So that's just a kind of a rough correlation on Republican versus Democrat, and how the whole dang thing has been so unfairly politicized. It's science, folks. It's medicine. It's not politics. Let's do it. Let's do it right. Okay.
Joe, are you going to continue with this attack on Republicans, or do you have some other ideas? Oh. Can't hear you, Joe.
Joe, you have to unmute.
How's that?
Better.
Am I unmuted?
Yeah.
I don't think it's a Republican-Democrat problem. I think it's more or less a leadership problem. I think we don't have the leadership that we need to direct where to go with this. It's so new to us. We knew no information whatsoever on this disease until recent. and the states are in control. Okay. In fact, I gotta admit, I really think, I think you feel that I'm a Republican, but I think we've got a governor who really did a good job or is doing a good job. Um, I think I'm very pleased with his attitude. I'm pleased with how he's kept it science and not politics, and where he's led us to so far with finding a solution for it. Um, but the President of the United States, there's another story. He's more interested in running for office. It's an election year, and that's not good for this problem also. And because it's an election year, he's out there trying to get more people to hear him, to vote for him, to go to his rallies. And by doing so, they're breaking all kinds of rules. They're not wearing masks. They're not staying 6 feet away. He's encouraging it. He's encouraging the problem, I think, then finding a solution for it.
Okay, since Bryan is not here on our panel today, I think I would have to maybe provide a conservative voice for just one moment. I know it's pretty easy to attack the president because he is the president and things are not going well, so it must be his fault. But just thinking back to the beginning, the very first case of COVID-19 in the United States was on January 20th. Within 8 days, President Trump created the coronavirus task force headed up by VP Mike Pence, right, and declared public health emergency, opening up $50 billion in funding and restricted travel from China. Patty, that 40,000 Chinese that came in, or people came from China, is brand new news to me.
They've actually stated that for a long time. It was not a complete ban, and that's one of the reasons it really didn't work.
I see. Okay, well, just to go on here for just a few minutes, the task force included Dr. Jerome Adams, who is the U.S. Surgeon General, Alex Azar, Secretary of Health and Human Resources, Anthony Fauci, head of the National Institutes of Allergy and Infectious Diseases, Dr. Robert Redfield, Director of Federal Centers for Disease Control and Prevention, and Seema Verman, Administrator of the Medicare and Medicaid, plus Dr. Deborah Bricks, who was the former Director of the World AIDS Prevention. This is the panel that Nancy Pelosi referred to as a bunch of quacks. In addition to establishing the task force, Trump arranged for hospital ships to aid in the treating of victims on both coasts. He dispatched the Army Corps of Engineers to convert the Javits Center in New York to a treatment center. He also arranged for American manufacturers to convert factories to manufacture respirators, masks, hand sanitizers, and other equipment and supplies to help the states fight the disease. He signed legislation providing $83 billion for corona response. According to the Center for Disease Control, this is just throwing this in, 94% of all the death certificates that list COVID-19 as the cause of death also listed other causes. And in fact, on the average, the certificates that indicated COVID-19 was the cause of death, they had 2.6 other contributing factors. And one of the things to keep in mind about the data, it's always way behind. The data is updated for many, many months after it's recorded. I wanted to get all that in to sort of defend against the constant charge that Trump has done absolutely nothing. In fact, I think it was Joe Biden who said, had he done his job, nobody would have died. All 200,000 people who died of the coronavirus would still be alive. So I
comment on this.
I think part of the problem was that I didn't feel that he came along quickly enough with many of these things.
Within 8 days of the first person, Patty. Within 8 days of the first death.
that he set up this committee, but then did nothing for the month of February. And saying in March, the problem is he was standing in front of the American people saying, this is going to go away. And then as far as, equipment, Ron had alluded to the fact that governors were, he was telling the states, it's your job to purchase this equipment. But those states were then competing with the federal government to purchase ventilators, to purchase PPE. They got to the point they were secretly ordering things from out of the country.
Patty, I would certainly like to hear more about the president's negligence, but we're out of time.
Oh.
Thank you very much for participating. And hopefully we'll see each other in 2 weeks.
Misinformation also.
I'm sorry, Joe, what?
I was just going to say that the president gave a lot of misinformation.
Then he really,
Okay. We'll have to sign off with that.
well, Joanna just upgraded our time, by the way. You didn't.
Yeah.
No,
We can continue a little bit.
okay.
Teddy Roosevelt called the presidency a bully pulpit. So Trump, okay, thank you for pointing out that the actions the federal government took was setting this stuff up. Trump didn't really talk that way, did he? He stood there and poor Dr. Fauci was just kind of shaking his head as Trump was advocating all of this stuff. And he talked to Bob Woodward came out in his book and said that early in January, Trump says, this is very terrible. Trump didn't say anything about that publicly for quite a while. And today I just said that I noticed that the committee wants to hold the next presidential debate virtually, and Trump says, I'm not going to contribute to that. I'm not going to do it. I'll hold a rally instead. So the man's it. What can I tell you?
Well, he is trying to, in the beginning, he had to make a decision on whether or not to cause a panic or not. And it would have been very, very easy to cause one. But the...
When I get in my car, I won't complain because I don't want people to be panicked about riding in automobiles.
Well, that's pretty good.
He also said that we would have a vaccine within weeks, and we,
Yeah, by
made it
Easter.
seem like the vaccine was really easy.
Ain't gonna happen.
He also, what was it he said about the acid? Take the
Bleach.
there was some, what was it?
Bleach. Yeah.
Bleach. Yeah.
He
I
said
mean, it was like he wasn't using science at all.
He said you could destroy the virus by wiping a table. If it's on a tabletop, you could wipe it with bleach. He didn't say drink it like Biden
No,
said.
he said inject it.
Inject it.
Yeah.
No. Okay.
Well,
One of the concerns that I've had recently too, though, is the fact that the CDC is being countermanded. For example, right now with all of I think there's 38 cases around the White House of coronavirus. Now they have their own little hotspot. And the CDC, which normally would do the contact tracing, they're not doing it. The White House has decided they're going to do their own contact tracing. I have a few concerns about that. There are also things that have been done to the CDC in their reports, and they've been countermanded by the White House because they didn't look good. We've got to be a little concerned because there's too much politics overall in this.
Yeah, there is way too much politics, and I really miss Bryan. He would be a good counterbalance. Okay, well, I think
it's easy to knock the president of the United States. There's no question about that. I'm not saying this right or wrong. What I'm saying is that because he is the president, he's got them. Do we believe him? And I don't find him believable sometimes.
Do you find Joe Biden believable?
Yes.
You do. Well,
Why wouldn't I?
Pardon me?
Why would you question my beliefs?
No, I didn't question. I just said, good for you. You believe in Joe Biden.
Well, I believe that he would do it differently, and he would,
Yes, he would.
with the science, much more with science than with politics. I don't think he would have had a lot of people at the White House not wearing masks and having, a rally during this problem.
You're probably right. Well, without knowing exactly how much time we have left, I'm a little bit
You've got
flummoxed.
about 1 minute.
Oh, okay, very good. Well, listen, folks, put your thinking caps on. I think maybe the next, in 2 weeks, we'll have an opportunity to talk about how well the debates worked. There was one last night. I watched half of it. I have to admit, the presidential debate was much more riveting than the vice presidential debate, even though the rivets were drilled into my brain, I think. It was a horrible example of how to pick a leader. But
It was not a debate.
well, it never is. I think that wouldn't you love to see the Harvard debate format employed?
Not really.
No. Well, you would know more about that than anyone. That would be a good idea. Next time you would describe how well, how you think the debate should be run, being a former debate coach. Okay, I think we're done.
Okay. Night, folks. Bye-bye. Good morning. Good
Bye.
evening.
Thank you.